Hello, everybody. Thanks very much for joining us today. My name is Kristin Anderson. I'm the Associate Vice President of Community Engagement at the University of Calgary, and I'm very pleased to welcome you to the School of Public Policy's webinar on political communications in the face of a pandemic. I have the pleasure of both hosting this, and I'll be jumping in to the discussion throughout today. The University of Calgary School of Public Policy is Canada's leading policy school, known for their practical and focused policy research, as well as bringing people together to discuss relevant and timely issues, of which, of course, today's conversation most certainly is. We will be starting with a panel discussion, and then we'll be followed by Q&A from the audience, and we're looking forward to taking your questions. Before we continue, I want to just say a few things. First of all, we are professional communicators and an academic. But we are not political pundits, so that's not the purpose of today's conversation. What we will be talking about also does not reflect the university's policy or the views of administration. With that, and without further ado, let me welcome my very esteemed panelists, and we will then dive into the topic. First of all, welcome to Dr. P.G. Forrest, who is the Director and James S. and Barbara A. Palmer Chair in Public Policy at the School of Public Policy. He also happens to be a very renowned public health policy expert. And also Morten Paulsen, who is the Director of Communications at our School of Public Policy. Morten has extensive experience in government, public, and crisis relations for some of Canada's highest profile corporations, mega projects, educational institutes, and nonprofits. So that is our panel. And now let's get into the conversation, shall we? First of all, let's talk a little bit about a crisis and how maybe what we're experiencing now is different, Morten, especially from what you and I probably have experienced in the past. Whereas I think when we've, been called to manage and help with some crisis communications, typically, in my experience at least, although it's an extremely stressful event for the organization or the individuals who are managing the crisis, you can kind of typically predict what a crisis arc might look like and sort of go through, talk to, your clients or the folks that you're working with about what to expect and how this is going to roll out. In your opinion, what lessons, Morten, from the private and public sector communications that you've undertaken in the past do you think can be taken away from what we're experiencing right now?
Yeah, thanks for that, Kristin. There's a couple. Now, of course, the COVID crisis is fundamentally different from corporate crises insofar as there's no actor at fault here, which is typically the case in a corporate crisis, where the leader of an organization or the leadership of an organization has to take accountability for something that's gone wrong. In this case, the gone wrong is completely outside of the realm of the actors. Having said that, there are two fundamental keys to taking control of a crisis and establishing effective crisis communication. One of which is trust, and I'll come back to that. The second one is owning the message, and I'll describe that in some detail. But the first is trust, and trust in messaging comes through a combination of taking the high road, ensuring accountability, transparency, authenticity. But in this case, trust was easily established, especially on the part of the provincial jurisdictions, because they made the very wise decision of taking somebody that's very trusted and putting them out front on the messaging, and that was public health officers. And that happened very early on. Now, what's the benefit to a public health officer as opposed to a politician? Well, simple. If you look at trust surveys, and there are any number of those out there that you can easily look up, but probably the most referred to and the best over time longitudinally is the Edelman Trust Survey, and it shows something that we won't be surprised at, and that is that academics, and especially people in the health fields, have the highest level of trust amongst the general public. So taking a trusted voice like that on a health issue, putting that person, a public health officer, out in front to deliver the main messages, and making the political players, premier, prime minister, frankly, secondary to the spokesperson role of the public health officer, helps to establish the trust of the spokesperson. But the second one is owning the message. And in the biz, owning the message means frequency of communications, regularity of communications, communicating to the right people, ensuring the breadth of communications to stakeholders. And in this case, again, it was relatively easy, though well thought out, insofar as the public health messages and the messengers were appearing on an extremely regular basis. Now, what does that mean? Well, if we take the case of Alberta, what we saw was a daily press conference, and that may not strike people as being very important, but it is very important. Because in the context of journalism in Alberta, where there are very few reporters left on any beat, but especially on the provincial legislature beat, there's only a handful of reporters. If you can get their attention with a daily 4 or 4:30 press conference, one that is coming very close to deadline, by the way, putting them under pressure to file a story quickly, then you do in fact own, at least in terms of journalism, you own the message. So you've got the frequency of the message, you've got the timing of the message, you've got a trustworthy spokesperson. So listen, in terms of execution of a campaign to establish public trust and to motivate people to what has been essentially a wartime effort of public solidarity, this has been very well executed. Did the players learn from the private sector and crises in the private sector? Probably, but they were working with high trust officials in a high trust environment, and with the kind of communication tools that allowed them to ensure that their voice around COVID was dominant.
Great. That's really interesting. PG, from your point of view, why do you see a health crisis as being a different beast from others with your hat on?
Yeah, this is a very interesting question, you know, because the health is different from other sectors in which I have worked. There's basically 5 reasons, and the first one, which is probably evident for everyone, is that what you do in health and in the healthcare sector has what philosophers call tragic consequences. And basically what it means is that it has life and death consequences. You decide that you will let people congregate in large groups, and you discover that you have spread a virus. And every time you make a decision, it could have decisions that will change the outcomes for people at this very basic level of life and death decision. And when you advise, what has been my role at one point in my life, when you advise the Minister of Health on decisions, you constantly have this on your mind. You know, will my advice have tragic consequences for someone? Because I have said it's not necessary to stockpile antiviral drugs, or we may not need that many masks. You realize that afterwards, that this has had very important consequences. The second reason is that physicians, nurses, public health experts, everybody working in that sector has been trained to respect the primacy of evidence. So it explains some of the things we have seen at the beginning of the crisis that have been, from a common sense perspective, so irritating. The evidence was that there is no need for a travel ban. Remember, this was the advice of the WHO, and has been the advice of the Chief Public Health Officer of Canada. Why? Because her training is to look at evidence first. This is your compass during a crisis. And in other crises, well, you will admit input from other sources. But my training as a public health expert have told that to people since February. You know, my eyes, I don't pay attention to the noise. I keep my eyes on the data all the time. The knowledge base is changing all the time. And again, we could take the example of masks. We could take the example of travel bans. And again, because you're trained to follow evidence, when the evidence base is changing, you change your mind as well. And it gives the impression sometimes that how could that change? She has changed her mind so quickly. Well, because again, training, we have in health, we have innumerable stakeholders, because every one of us is a stakeholder of the decisions that are made. And so very often we want to be part of the decision. And it makes life for people making those decisions very, very difficult. Finally, my fifth point, is the fact that all this is taking place. Again, this is very different from the type of crisis with which Morten has been confronted in the private sector. You have multiple arenas. So you're dealing with the media, you're dealing with, I could tell you that during this crisis, especially the first 4 weeks, the government of Canada inside the government was divided on what to do, what was the nature of the answer. So as an expert, as an expert contributing advice, you're in the health arena, in the government arena, in the House of Commons arena. And as we have seen in this crisis, you have to cope as well with the global arena, with your neighbors like the United States and with the WHO and so on and so forth. It makes those crises incredibly complicated, and it has for people that are comfortable navigating in that particular environment. It's very difficult to train people for this.
So if I'm going to merge the points that the excellent points that you've both made into one kind of next question, it really is, how do you take the academic and the research-based information that you get from all the public health experts that you have informing you this is a communications question, and then filter it so that a politician can deliver that information and ensure that they're well briefed with all of these moving pieces in the background? What's your, I guess, best advice, maybe both of you, and maybe from both lenses, PG, for you as a public health expert, how do you ensure that that flow of information goes as smoothly as possible? And then Morten, on the other side, making sure that that's being communicated so that, people are reassured and the right messages are being conveyed to the proper audiences.
So I think there are two aspects to your question. One is, of course, that it has also to do with your training. It's the you end by being trained to be a knowledge broker. To have a sense. Research is not created equal. And we have seen that again during the COVID crisis. You have to have an instinct, but also good training that helps you distinguish between something that is probably, again, just noise and something that could have a real impact on the way the crisis will need to be managed. And there is no substitute for training. There is no substitute to have done that for a number of years and being used of acting as a broker between the research world and the policy world. But there is also the second aspect to the question is how do you interact with the decision makers? One of my friends and mentors, he was for a long time Deputy Minister of Health Canada. He has been Deputy Minister of Foreign Affairs after that, Maurice Rosenberg. And I decided that to call this law Rosenberg's Law in his honor, because he was telling us all the time, you never go to a politician with a problem without a solution. And you learn to do that too, So if I'm bringing you a problem, I need to have a solution at the same time. You need to have a solution that is bringing benefits, and benefits for the politician herself or himself. Those benefits have been to be measurable in the short term. You cannot just sell something you will see. In 5 years, we will find a solution for this. It doesn't work like this. And Rosenberg was always ending his little lecture saying, you know what, sometimes the best solution is to do nothing. And you have to be modest sometimes. And it's difficult. When you're called for the first time by a minister for giving advice, it's very tempting to say, oh, I will change the course of history. Sometimes you don't know, and sometimes it's better actually to wait and do nothing. Humility is part of, I think, one of the important skill set of a good advisors.
Yeah, and Kristin, you asked about how to deal with facts changing, with the message changing, and one of the core principles of effective, at least corporate, but also political crisis communications is consistency of message. make sure you say the same thing over and over and over again so that the public believes you. Well, this has been totally blown up in this situation where facts and knowledge have been evolving in real time. PG referenced this: masks or no masks, 1 meter or 2 meters, etc. But it's been remarkable to me what the provincial spokespeople on this crisis have been able to frankly get away with. Because we're dealing in such a high trust environment. And again, this speaks to who's delivering the message. The message is being delivered by public health officials for whom the public assumes are working in the best interests of the general public. Now, if it was a politician whose message was changing, and we see this in the case of Donald Trump, where the message evolves over time, the public is going to assume either ineptitude or a hidden agenda. But that's not the case in this ultra high trust environment where public health officials are delivering the message. We're assuming that the change of message is simply a public health official keeping up with best practices and delivering the messages accordingly. So, while there are a number of lessons to be learned from corporate or previous experience, I'll bet you every politician worldwide who's watching this just wishes they could have the trust level that the public health officials have, because again, they're able to deliver evolving messages, which is something that's normally very hard to do.
So, notwithstanding, and I'll stop just asking the questions and participate in the conversation too, but let's go to this then. Notwithstanding the fact that we are dealing with this high trust environment, and our assertion is that putting forward the public health officials and the experts is sort of the standard for communications, I think it's fair to say we're seeing some politicians, I actually looked for some polling numbers and I don't have the, polls that I could show up, but some are kind of rising and some are perhaps not in the same way. And maybe we should take a look at some examples of, who seems to be unexpectedly perhaps shining and those that are not. And we have a couple of slides here that maybe we'll throw up here. So here we have, I think, some really great examples of our public health officials taking the spotlight. So some of what we've been just talking about. And then maybe if we could go to the next slide, please. Nope, and the next one. We'll come back to that one though, thanks. So here we have, I really loved this example of Premier Ford baking a cake over the weekend. And he's got his "We're All in This Together" t-shirt, and he made a cake. And it was just, I think we should have a conversation maybe about different leadership styles. And why don't we talk a little bit about that? So which politicians kind of seem to be rising with this and which aren't? And if our assertion is more or less some of these politicians are using the same tactics, going back to our public health officials, what is it about somebody like, say, Premier Ford's presentation versus maybe some others that we should be taking some lessons in communications away from? And I'll let you guys start and then I'll jump in.
I don't think Doug Ford's approach has been out of character for him. His man of the people persona has always been his signature, and that's something that works especially well in a situation of mutual deprivation. We want to know that our leaders are experiencing the same deprivation that we're going through, and Ford has been very, very good at that. It's interesting contrasting the fact that Doug Ford took a little vacation out of town. So did Justin Trudeau. For Doug Ford, that was interpreted as a little R&R with the family, well-deserved. And for Justin Trudeau, that was something else, somehow being immune from deprivation or above it. Now, part of that may be the vagaries of the Ottawa Press Gallery versus Queen's Park. I don't know. But in this case, Ford has been consistent in his common man, if you will, approach.
Yeah, I agree with that. And I think that it also helped that he went hard after some of the price gougers at the beginning and made some
Right.
pretty strong comments about, about Trump and the masks, et cetera, et cetera. And I think also I would agree with you that I think this is a time when that authenticity, I think, has really shone through for him.
Mhm.
So I think he knows his own weaknesses and has kind of said, I'm going to leave the science to the scientists, and I'm going to, I think, largely set down politics. And I think that you're right. I think it's interesting that that authenticity has given him a little more latitude for some of those so-called mistakes than perhaps others were able to do in the same way.
Yeah,
And then,
the last slide had an interesting picture. It was the picture of Alberta's chief medical officer
yeah, can
with
we go back to that one, please?
yeah.
Yeah, thanks.
And there it is on the
Yeah.
left, and that tells a heck of a picture. You had the premier of the province standing behind the chief medical officer, and letting her take the lead figuratively and literally, and that speaks to the points that I made earlier in terms of ensuring you've got the right high trust official delivering the messages.
Yeah, absolutely. I think it's amazing that we've got our public health officials become some of the biggest stars in the country right now. It really, I think, reinforces the point that you're making. Go ahead, please.
Could we show the Quebec? Yeah.
There we
So
go.
what is interesting here is that it started the same way in Quebec with the man on the left hand side is the director of public health for the province, Horacio Arruda, and he was unbelievably popular during the first weeks of the crisis. So every day, the premier was Legault was in the center, the Minister of Health was the woman on the right hand side, and the director of public health were on the stage at 1 o'clock every day, and they will do a press conference where the premier will be the one doing most of the talking, and Arruda will do most of the gestures, and he became very famous through meme and GIFs about the way he was talking about the curve and the like. It was incredibly popular, his own Facebook page. And what I found very interesting, and as long as he stuck with his role of public health expert and director of public health, his popularity was like without no comparison in the province. And then he hired a specialist in political communication and start to be tempted to enter the conversation no more as just the director of public health, but have someone that will move the conversation. And you have seen him attacked and criticized in the media nearly immediately, including in comments made by people. And it shows that your role as director of public health during those crises is to stick to your role. You're there because your credibility, as Morten explained very well at the beginning, your credibility is because you're a public health expert. Leave to the politician to do the politics during that period. And what we expect from politicians is very simple. Information, those are the Harvard rules, information, empathy, and hope. And the premier, as the premier did here, as the premier did in BC and in so many other countries, been very good at expressing those very simple things, leaving to the experts the role of explaining what was happening, what were the consequences of exposure to the virus, and so on and so forth.
Excellent, thanks. Maybe let's move on to because I want to get to the Q&As with our guests, but I have a few more questions for us to kick around amongst us, and then we'll go to the Q's and A's. First of all, let's have a quick conversation about what some of the foreign leaders are doing, what's working well and what's not. And we had a bit of a conversation internally about does gender play a role? Is it, we see that, over here on the left, Angela Merkel and Prime Minister Hearn from New Zealand have been very well regarded for their handling of this, and then potentially less so. Boris Johnson is an interesting case, having contracted the disease himself and going through the experience that he has firsthand, and then of course President Trump. And I'm wondering, is this a gender issue or a leadership style issue? Let's have a conversation about that. And I think I know where we're going to land on it, but what's going well for them and maybe what are challenges from a communications point of view?
We can speak to Donald Trump, which is just easy and fun to do. Listen, Donald Trump has been, as usual, inconsistent and delivering messages that are either out of touch with what other jurisdictions are doing or best practices as are known at the time in health. So he's a good example of what not to do, how to lose credibility, and he's done that in spades. I mean, Boris Johnson, what a stroke of luck to actually come down with COVID, because he's been through it. How much more person of the people can you be than somebody who's actually contracted and lived through the disease? But I would have to say that, you know, this is a two-stage crisis, and I'll talk later about the second stage of political COVID response and communications. But the first stage is the public health crisis, and that's a stage not unlike a wartime conditions, when you generally see a bump up in polling numbers, where you see a rallying around leadership, and you're seeing that largely globally. You're seeing softness for Trump, of course, predictably, but generally you're seeing a rallying around leadership. That's likely going to change, and change quickly, as we move into the second stage, which is post-COVID.
Yeah, so Ardern and Merkel have been spectacular. I think unless you're really, anybody with good faith have to admit, their management of this crisis has been, again, absolutely fantastic. And in part, what I found very interesting from my point of view, not from a political perspective, but from a public health perspective, is how close they have been to the textbook, rules of how you manage a crisis like this one. There's something in my trade that is known as the Cdc Rules, because the CDC in the US have formulated those rules way back. My friend and colleague, Josh Sharstein at Bloomberg School of Public Health at Hopkins in the US has given them a new formulation just before this crisis. And when you apply this grid to what Ardern and Merkel have done, you realize, and it might be because they were well advised, but it might also be because they have a remarkable instinct for this, and the rules are very simple. And the first is be first. When this starts, you have to be the first at the microphone. And in both cases, I have seen them do that. The second thing is to be right. And to be right, you have to be able to listen. And listening is not a quality that Boris Johnson and Donald Trump have, let's say, demonstrated in the past. But it's clearly something that both Ardern and Merkel have been able to do. The third one is to be credible. And I was reading a piece on Ardern that I found very interesting. Credibility in a period like this is essentially not only having your own credibility, but avoiding multiple voices. And one of the things that is known is Ardern has forbidden any of his ministers to actually speak publicly since the beginning of the crisis, to make sure that there is only one voice speaking on behalf of the government of New Zealand. Of course, you have to be able to express empathy. You have to be able to promote action. When people are listening to you, they want to know what you're asking them to do. And it could be very simple thing: wear a mask, keep your distance, wash your hands, but you need to be constantly able to promote action. And again, go back to the speeches given by Merkel and Ardern. It's fascinating. There is never an opportunity missed of indicating to the public what they wanted them to do during that period. And finally, show respect, both for the victims and for the population, and for even the people that are criticizing you and have different viewpoints. And again, they have been I don't know how much this is training. I don't know how much this is advice. I don't know how much this is instinct, but I'm pretty sure that for the years to come in public health textbook on crisis management, you will have at least a vignette on Jacinda Ardern and a vignette on Angela Merkel during the COVID crisis.
That's really, really interesting. I'm going to go to, I have more questions for us if we run out of questions. We've got some really great Q's and A's coming in. So let's go to some of the questions that were being asked here. So the first one is, do you think that, do you run the risk of losing the public's attention through too many presentations? 70 days of daily press briefings can be fatiguing. So that's really an interesting question, and I might jump off on this. I was talking to, in preparation for this, some folks in different provinces about the different styles of some of the leaders, and I haven't confirmed this, but I understand that in British Columbia, Premier Horgan has left this largely to the public health officials and is only doing weekly briefings. And the argument in that instance is less is more. And I think that we saw, for example, here in Alberta, that we might have had a little bit too much of Premier Kenney when after the date that there was the pressure to release the data, as you will recall, he did the press conference the evening before and then followed up with a larger one the next day, which I think maybe wasn't well taken in some instances. And again, this is just from a communications point of view. I wonder if that might be an example of why that didn't go down well, and is in some ways because maybe it was just a little bit over communication. So it's an interesting question, and I'm wondering, do you guys have any other thinking on to add to that?
Christine, I'm not sure. I would say, again, I may be completely wrong, but my impression is that in the case of Trudeau, for instance, because there is this idea that being present is very important in time of crisis. Politicians that are not showing up when the population is facing a major event, whether it's a weather event, whether it's a health crisis, are always paying a huge price. I remember a mayor in Montreal that was on holiday at the time of a major storm that has inundated part of downtown and so on, and decided it will not be helpful for him to come back anyway. And he paid a huge price for that. People are expecting you to be there, to be present. And I'm pretty sure that what we have seen in Trudeau's ratings in terms of approval, it's in large part because of this steady presence at 11 o'clock Eastern time every day. Doing a very simple message, as I said at the beginning, about information, empathy, and hope, all the time, very simple. That he's not a great orator and so on, but doesn't matter. The important thing was he was there. And this steadiness, I think, has played a very important role in giving people the impression that the federal government, the national government was caring about this, about them, and that they were, every day, there was some work done on their behalf. And so being present is important.
Yeah, and predictable as well. I think that there's a comfort to be taken in a time of crisis with the predictability also. So I would agree with that. Morten, is there anything you'd like to add to the discussion here?
There may come the time when we tire of the daily press conferences and the daily updates, but I don't think we're there yet. Listen, what we've gone through in the last couple of months is absolutely unprecedented. The quarantine, the deaths, the massive hit to the economy. Is something we haven't seen in terms of its overall impact on the society since the Great Depression or since the wars. So is a daily press conference too much? Is it? No, I think it's something that's absolutely called for. Whether or not that'll continue to be the case, we'll see. The other benefit of the daily press conference, that combined with the fact that legislatures aren't sitting because of social quarantine, is there's no opposition. The leaders themselves own the pulpit with their public health officials. There's no daily question period during which the leaders can be questioned. There is literally no podium that can be commanded by dissenting voices. So that's been of utility to the leaders, and frankly, given what public health officials and political leaders have demanded of their citizens over the past couple of months, I think that kind of daily briefing is appropriate.
Great, thanks. I have another question here. Do you think that the WHO will take care in the future to choose a leader who is a physician and has never been a politician? The current leader was Minister of Health for Ethiopia during a time of severe repression based on linguistic differences. That seems to have been part of the loss of trust in the WHO. Loss of trust in the WHO. Thoughts on that one?
Yeah, I think the WHO is going to suffer from the worst possible thing that could happen to them, which is irrelevance. This has been a situation that has been managed by national or provincial leaders, and best handled by leaders that are closest to their voting population. The WHO was seen as discredited in terms of advice, and frankly, just don't matter much in terms of the real response to this thing, which has been local.
Yeah, I'm less convinced that, Morten, because they're doing a lot of other things that will still be needed. Even during that crisis, I think that when we will have more insight on what happened. A lot, personally, I benefited a lot from the data that came from WHO at the beginning. They are dependent on the governments that support them and inform them. I will not be surprised if the leadership of the current Secretary General was actually questioned at the end of the crisis, but this is another question. I don't think the organization itself will suffer that much. Again, they're doing so many other precious things. They managed the Ebola and the Zika crisis incredibly well, and this is not that far away. This crisis was very special. The surprise, I think China will have a lot of questions to answer at the end of this, especially not necessarily after they have actually accepted the idea that they were caught with an outbreak. The data they provided at the start were of a very, very high quality. Have they provided the full data? I'm not sure, but the data they provided were of quality that has been validated in other cases afterwards. So you see, again, beware of the noise. The incredible level of noise that has been generated by a global crisis of that sort. That, at least for me, for you, for so many people, is the first crisis of that type we have ever seen.
We have a question here. It's a bit of a long one, so I'm going to try to shorten it a bit. But to what extent do those in the public health sector actually listen to and communicate experiential evidence that a lot of us have learned from years of public practice? So this writer is giving, for example, the general public is increasingly supportive of using masks, whereas the public health sector does not consider this to be important.
So I think the first part, and then I let Morten and you jump in, but the first part of it was I said at the start, that we are trained to respect evidence, and it's difficult sometimes. On mask it will be a very interesting case study after all this, because the only evidence that was certain, by standards we normally use for the drugs that are prescribed and the treatment that are prescribed, was that it was helpful to wear a N95 and that surgical mask. We learned that relatively early in the process. Were not bad at all either, but of course we were concerned that we won't have enough. But there was very limited evidence on wearing non-medical mask, and there is still very limited evidence on the benefit. Overall, it's probably a good idea to wear mask, if only to protect others. And we have more evidence of this now coming in. And you're seeing the public health experts shifting their viewpoints. Again, because we are trained to do that. Evidence, the knowledge base, it's changing. People are, moving at the same time. This knowledge base it's moving. But again, I understand the first reaction has been, yeah, but the evidence is saying it doesn't work. The thing that we know for sure is that washing your hands makes a huge, huge difference. And if you wash your hands 6 times instead of 2, it will be doing a measurable difference. So public health experts were trying to convey that to people. Mask, yes, but have you washed your hands? Well, and that's the real question, I think.
No, PG's exactly right. I mean, fundamentally, this is a virus, and it needed to be treated like a virus. Undoubtedly, as days go by, this will be the most analyzed and reanalyzed virus in history, in terms of its contagion and its spread. But it's fundamentally a virus, and the advice that was received early, which is keep your distance, wash your hands, and sneeze in your sleeve, is still fundamentally good advice.
So I'm looking at some of the other questions. So how about this one? The daily update from the Prime Minister maintains a presence, but is there not a price to be paid when things go wrong? For example, in particular, when a payback plan has to be implemented, we fully understand the financial costs. So I think it's a great question, because I think, if you're owning it now and you're there every day and, you're making all these announcements, when the full understanding and those chickens come back to roost, from a communications point of view, would those particular leaders be maybe sorry that they owned it as much as they have?
Oh yeah, totally. As I said before, we've been treating COVID as a single stage crisis, and it's not at all, not from a political perspective. It's a two-stage crisis. The first stage of the crisis is the disease itself and managing the contagion. The second stage of the crisis is managing what will be depression era unemployment, ballooning debt and deficit, reduction in a drastic reduction in government revenues, and the ability of governments to maintain the kind of services that we've been used to without running even more massive debt. Now, this is where it's going to get hard for the politicians. The first stage is relatively easy by doing all the things that we've talked about before, and by calling upon the goodwill of Canadians and Albertans to rally around the flag in the name of disease prevention. But once the COVID crisis itself starts to dissipate, then we're into a political crisis, and that's one that you can't put a public health official on the podium to deal with issues of debt and deficit and unemployment. That's something that's got to be owned by the politicians. And I'm sure right now every politician in the country is busily preparing for stage 2, which is going to be much, much more difficult for them.
Yeah, and do not envy our premier here, who's really fighting a double-pronged crisis with the economic burdens that are already underway, plus what is coming. I agree with that completely. Do you want to add to that?
We shouldn't, underestimate the politicians' capabilities. They're not just passively living this crisis. I think that it has been maybe the case for the first days, but without them, it will have been very difficult to find support for a lot of the measures that have been put in place. And I'm not talking only here, I'm talking about all over the world. They have sometimes shown much better judgment, to go back to the previous question, than many experts, and their capacity to feel where the population was ready to go, that, people were more ready sometimes to adopt, for instance, at countries where wearing a mask was unknown 6 months ago, and then now you're seeing population in public spaces using it without much constraint, with very often the people, 85% of people are compliant. So this is the work of politicians. This is not the work of experts. So I'm expecting them to pivot, you know, in the next few months and do their work, which is also to bring convergence between, this is what they do for a living, you know,
Yeah.
a convergence between public opinion, stakeholders, representations, and expert advice. And they will stop listening only to public health people. They will start to have more and more economists and policy wonks coming on board and starting helping them rebuild consensus for action. And so I don't think we shouldn't be thinking that what we are going through now, and I totally back Morten's idea that this will be a two-stage or two-steps crisis. And in the second step, you will also see spectacular leaders and leaders that are ill-prepared or less well-prepared to deal with this reality. Because it's pivoting, as you know, in our daily life is complicated. And but politicians are sometimes, you know, I have a lot of admiration. I work in the shadow of these people for most of my career, and I have a lot of time for them. They amaze me. You know, I won't be able to do that personally. Yeah.
Yeah, I agree. I think governing is much harder, I think, than people think. You've got to juggle so many competing priorities at all time. And these are largely people, you know, if you agree with them or not, people who have entered politics because they have a strong sense of public duty and public service. And this crisis shows you, I think, that you never know what you've signed yourself up for in these events. So I agree with that completely. I'm going to bundle, we're running out of time, unfortunately. I'm going to bundle two questions together because I think we can do that. So the first one is, how can politicians navigate delivering unpopular messages and keep people engaged in spite of criticism or pockets of public outcry for more or different responses? And then the question I'm going to bundle with that is, how much does a person's personal politics and party affiliation affect how he or she hears the message from a leader? Because I think keeping them engaged, I think one of those questions kind of ties nicely to the other. So, and let's see if we can answer both of them at once. So go ahead, guys.
Sure. Well, the first one, how do we, if you will, keep this going? I'm never amazed at the goodwill of the public, and especially of Canadians. The willingness of Canadians to, if you will, take direction, but to cooperate in times of struggle, in times of crisis or challenges is simply remarkable. And they do take direction from their leadership. You know, there's the old joke about how to get 50 Canadians out of a pool on a hot day. Well, you ask them. And I'm convinced that as long as there is a public health goal that we are collectively striving for, that we're going to continue collectively striving. So there's a great deep pool of political goodwill and capital that our leadership can continue to call upon. What was the second question, Kristin?
Does your political affiliation change sort of your ability to kind of hear the message?
Yeah, I mean, you're certainly seeing that in the States where there's been a lot of polling done, and I'm not sure that I've seen it in Canada, but we can probably extrapolate to some degree that amongst those whose bias is a distrust towards government, which is those on the right or the Republican or the conservative side, well, there's a bias towards distrust of the government. And when government moves in with measures that are sweeping and that have a dramatic impact on individual lives and on the country, that there is a tendency towards distrust. So amongst those folks, people on the right, people on the Republican, people on the conservative side, I think you'll see that as a demographic that is harder to keep engaged on a massive public health issue.
Do you want to add to that, PG?
You know, the US is now such a strange political system, you know, because of the incredible degree of polarization and the way people are filtering all the information they receive through the prism of their political opinions. And so it makes it very complicated. But elsewhere, you know, we have seen, but it won't last. This is the thing. It's, you know, it will last the time of the crisis. You know, approval rates have gone up. Belgium, that was incapable of giving itself a government for years, have finally a government under a female prime minister, by the way. She has been able to do with COVID what nobody else has been able to do for years. So will it last? I'll be surprised. But for the time being, it has created rather like everywhere a movement of national solidarity in the sense that, you know, everybody, it's in my trade, we call that the lifeboat ethics. You know, we're all on the lifeboat, and at that moment, suddenly a lot of differences have to be forgotten, and you're basically trying all to survive. But you know, when you're back on another larger ship, well, some are going to the first class and some are going back to the second and third class. Yeah.
Yeah, I've commented to some of the, you know, my network and circle is that I think this crisis is really showcased in a way that I don't think we could have really understood before, that our values of peace, order, and good government. Because I think that the Canadian response to this, but I think it's fair to say it's not just a Canadian response, but I think if you take a look at how Canada has been able to, you know, it's kind of to Morten's point, how do you get all the Canadians out of the pool? You know, we have these values, and it's interesting to me how they really are kind of baked into us, and we don't realize it until we have a real crisis like this to bring us together. So hold on, I'm just going to take a look at the time. So we've got 9 more minutes, so I think we've got time for just a couple more questions here. I will, again, try to bundle them together a little bit. This one here is a question about, and I think it goes back to one of the comments that one of you made about the legislature's not sitting. So it says there's no podium for those with dissenting opinions. That's clearly beneficial for controlling the message, but does not this, after more information becomes available, lead to a loss of trust in those on the podium, both the politicians and the health officials? So that's an interesting one. They've kind of got the platform all to themselves right now. But are we confident that when more information comes that they'll maintain that?
No, I mean, listen, once the opposition is given their podium back, once the media no longer have to digest a daily press conference announcement, yes, there's going to be increasing criticism and increasing question of especially the government's action. So is this all going to change? Yeah, absolutely. Added to that, you've got social media, and a lot of social media, contrary to what some people think, a lot of social media is simply the repetition, the regurgitation of mainstream media stories, and those have been so concentrated on COVID science, COVID response, that once that starts to back down a little bit, then you're going to see increasing noise from the online arena as well. So is the communications world for politicians going to change pretty quickly as things resume? Yeah, you betcha.
And we're seeing that already. You know, it's true that at the peak of the crisis, there was not a lot of space for dissenting opinions, you know, other than on the margins. But I could tell you now that if you look at the space, both media and public opinion at this moment, we are seeing more and more different viewpoints organizing themselves and expressing themselves. It's very interesting for me. You know, there is much less experts on removal of public health measures than on imposing them. And therefore, we don't have been able in most places, this is one of the message the University of Calgary experts have been pushing for weeks now, you know, keep the message simple also during the removal. You know, no more than 4 basic messages that you need to reinforce. And it has been very difficult. In many places, the removal is creating a lot of noise and contradictory messages are coming out. And the more you do that, the more you're seeing dissenting opinions expressing themselves.
Mhm.
I don't think we have killed, the capacity for dissent in our society. I don't think it's even threatened at this moment. And you will see it will come back like the flowers and the leaves in the trees sometimes in Alberta.
Yeah,
Well, it sure will. And, one of the big discussions that's inevitably going to happen is, did we go too far? Was this whole effort worth it in the context of the spread of the disease, mortality rates, et cetera? And, somebody who I think just positioned himself spectacularly at the start of this was Mayor Nenshi. He said in repeated interviews, I want to be the guy who, after this thing is all over, is accused of having gone too far. Well, talk about setting expectations. He has put himself in an absolute no-lose position. If we decide after this is all over that we've gone too far, well, he established early on why. So that I think was just a stroke of genius.
yeah. We have so many more questions, but we're running out of time, and I'm gonna reserve the right to ask the last one myself before we wrap up. And I'd love to talk about what positive takeaways do you think that we can take from this unprecedented experience. I'd like us to, it's been a great conversation, but I had two. So maybe what would be, you can answer one, the other, or both. What will be forever changed out of this, and what are the positive takeaways from this experience?
Well, I'll channel Preston Manning and give you one. I think, for the longest time, there have been silos between politicians, policymaking, and science, and I think to some degree this crisis has broken that down, and to the extent that that has occurred, that's a good thing. So if in the future, unless there's some weird boomerang of public opinion, if in the future we take anything away from this, it's that our scientists, our public health officials, our experts have a significant and beneficial role to play in policy making. So I hope that's a takeaway.
Yeah.
Yeah, for me, and it has been invisible for most people, but at the start of the crisis, I was very concerned by the state of relationship between the provinces and the federal government. And in fact, it's amazing how well this has unfolded for the duration of the last now 2-3 months. There has been hiccups here and there, tensions here and there. And again, the removal of the public health measures is more complicated because you cannot let a province go by itself and then becoming a new cluster, the source of a new cluster of infection. But all in all, it has worked so well compared to experiences of the past. And I think and I don't think people at the start knew it will go as well as it went. And I think it's part is goodwill, in part is because the federal government, again, we have to tell, this is part of the story, has been incredibly respectful of provincial jurisdiction during this crisis.
Yeah. And mine, I think it's kind of builds on both of yours, and I hope that it lasts, but I've been really heartened to see the real, largely lack of partisanship. I think that the political dialogue in this country had gotten really very toxic, both, intra-provincially and nationally as well. And I think it's almost like you need the alien to land from outer space to kind of teach you to pull together. This is sort of, unfortunately, a version of that. And so I think it's been really good for us. And time will tell if that lasts, because I think there's huge challenges to come. But yeah, so I'm glad that we're leaving this on a high note. I have a script here somewhere that says, wow, that time went fast, but it really did. That went really quickly. So thanks to both of you so much for participating in this discussion today. Thank you so much for inviting me. It's been a ton of fun, and we left quite a few questions on the table. So my apologies to everybody who participated and whose questions we weren't able to get to, but thank you very much for participating. We have at the School of Public Policy a number of webinars coming on a variety of topics. So I'd like to encourage everyone to head over to policyschool.ca to take a look and to register for those as well. So, and thanks very much before we go to our colleagues at the School of Public Policy who worked really hard behind the scenes to make sure that the technology was working and we got the slides and helped us all get briefed. So we don't want those contributions to go unnoticed, and thanks so much to them as well. So I think that's it for us, and enjoy the rest of your day. Thank you.
Thank you, Kristin. Nice work.
Yeah.